Okay, have you heard this one before? A dentist says, you know, you don't have to floss all your teeth, just the ones you want to keep. It's an oldie but goodie. Patients hate flossing, and what I really notice is that for 2 weeks before their checkup with the hygienist, people get really good about it and they're flossing all their teeth. And you know, it cuts your gums. You can see. I mean, we can tell. You're not fooling anybody. And for about 2 weeks or 3 weeks after the checkup, then the patients are also really good about cleaning your teeth, which, by the way, on another topic for a future video, is one of the strongest arguments for seeing your hygienist more than every 6 months. People who see their hygienist maybe 3 or 4 times a year have much healthier mouths because they're always just coming off of a checkup or just coming up to one, and so their home care is better. But that's a topic for another time. Today I want to talk about floss cheaters. And I don't mean people who cheat and lie about flossing. I'm talking about floss cheaters as that's what I call devices that you can use instead of flossing. Flossing's hard. To properly do it and to get all the nooks and crannies, it's really, really challenging. And we know that. But it's so important because the plaque that you're removing that's between your teeth is actually food debris and proteins and just debris that's in your mouth mixed with bacteria. And if you take a scraping of that soft white material off of your teeth and looked at it under a microscope, it looks like maggots teeming and crawling all over each other. I mean, it is disgusting. If you could see what it looked like under a microscope, or if you want to even be grosser, smell your floss after you use it, and you can smell the just dead tissue and grody bacteria smell. So anyway, you want to get all that out of there, but it's really hard to floss. And so there are some great devices available now that are almost as good as flossing. I mean, really, really, really close second place as far as being effective at keeping the spots and the nooks and crannies between your teeth even cleaner. And remember, this is important because keeping that bacteria out of there, if you look at the other videos that we have about periodontal disease, flossing will help you live longer. They have a list of things that will help patients live longer. Flossing, drinking more water, exercising, and not smoking. They're in there. They're all in that top list. So anyway, my favorite current product, it literally just came on the market. I'm a little leery to talk about it because we're having a hard time even keeping it on the shelves. And so I don't have any to sell. We're taking pre-orders for them, but that's not why I'm excited about the product. It's not a money-making thing. It is really effective. So anyway, what it's called is an air flosser. And this particular one is made by Sonicare. It's really light and small and easy to travel with. And it's basically a travel size water pick. But what you can do is in this compartment right here, you can fill it with some sort of medicated mouthwash. A prescription mouthwash is the best, or an over-the-counter Listerine type product is okay. But you fill that reservoir. You can even put warm water in there if you have very sensitive teeth. You turn it on right here, and then you activate it 6 times. Oh my goodness, I'm making a mess all over my desk. But that's what it does. And so you use that right between your teeth, and you can actually see it blast the plaque right out of there. Oh goodness. So anyway, I think that this is just the bee's knees, one of the greatest things to come along in a long time, and I really think our patients will be healthier for it.